You're listening to Living Room on ReachMD. On this episode, we'll hear from Dr. Louis Bessette, who's a professor of medicine at Université Laval and the director of the Center for Osteoporosis and Rheumatology of Quebec. He'll be sharing key insights on early arthritis from the CATCH cohort, which he spoke about at the Congress of Clinical Rheumatology East Conference. Here's Dr. Bessette now.
So CATCH, or the Canadian Early Arthritis Cohort, is a national multicenter prospective cohort that has followed nearly 4,000 patients with newly diagnostic inflammatory arthritis across 25 academic community sites in Canada. And that cohort started in 2007. What makes CATCH partially variable is that it captures real-life, high-quality, standardized data very early in the course of the disease, often within a few weeks after the onset of symptoms. Actually, I think most patients have 6 weeks into the disease when they were recruited in CATCH. So unlike randomized controlled trials, CATCH reflects what actually happens in routine clinical practice. It integrates detailed clinical assessment, treatment imaging, and an unusually rich set of patient-reported outcomes. Several findings stand out. First, what we found is that early optimized methotrexate-based therapy work very well in most patients. We have shown that rapid initiation within a few days after diagnostic and early dose optimization, including sub-Q methotrexate or combination with CSD-MARS strategies, leads to higher rates of remission and over time, very few treatment changes. The second finding is that CATCH has highlighted that achieving remission is common, but sustaining remission is very difficult. In our CATCH cohort, less than half of patients remain in remission 1 or 2 years after reaching remission. So there's many factors that may explain why patients transition between remission and low disease activity, such as female sex, smoking, obesity, comorbid conditions, delay response, and some patients did some treatment tapering over time that lead to losing remission. Another major insight is the impact of social determinants and comorbidities. What we found is that lower socioeconomic status and higher comorbid condition are consistently associated with worse outcomes, despite very similar strategies between these patients. Finally, CATCH has shown that non-inflammatory pain, mental health, and patient-reported symptoms are the central drivers of disease burden, especially in the first year, and are often under-recognized in the treatment strategy that we use in clinics. CATCH has reinforced several shifts in day-to-day practice. Clinicians are much more confident in starting the MARDs immediately and aiming for disease control within the first 3 to 6 months and using a treat-to-target strategy. And, using also the validated indices of disease activity, such as the CDAI. The data have also pushed us to think beyond inflammation alone. There's growing evidence that patient-reported outcomes, pain mechanisms, comorbid condition, and adherence must be addressed very early if you want durable remission for patients. CATCH findings also highlight misalignment with guidelines, particularly around prolonged glucocorticoid use and delayed treatment escalation in some patients, reminding us where real-world practice can still improve.
That was Dr. Louis Bessette talking about his presentation at the Congress of Clinical Rheumatology East Conference, which focused on what the CATCH cohort has taught us about early arthritis. To access this and other episodes in our series, visit Living Room on ReachMD.com, where you can be part of the knowledge. Thanks for listening.